is the study of disease by scientific method. The word pathology came from Latin word feto and luci. Feto mean disease and luci means study. Therefore, pathology is scientific study of disease. Disease may in turn be defined as an abnormal variation in structure or function of any part of the body. So pathology gives us explanation of a disease by studying the following four aspects of disease: etiology, pathogenesis, morphological changes, and functional derangement, and clinical significance. So dear ladies and gentlemen, we are coming to discuss etiology. Etiology is the study of a disease, mean the cause of disease. If the cause of a disease is known, it is called primary etiology. If the cause of the disease is known as idiopathic, knowledge or discovery of the primary cause remain the backbone on which diagnosis can be made, a disease understood, and treatment developed. There are two major classes of etiologic factors: genetic and acquired infection, nutritional, chemical, physical, etc. Detailed discussion will be given in subsequent topics. The etiology is followed by pathogenesis. So we are coming to discuss pathogenesis. Pathogenesis means the mechanism through which the cause operates to produce the pathological and clinical manifestation. The pathogenetic mechanism could take place in the latent or incubation period. Pathogenesis lead to morphologic changes. So we come to discuss morphologic changes. So what is morphologic changes? Morphologic changes refer to the structure alteration and cell or tissue that occur following the pathogenetic mechanism. The structural changes in the organ can be seen with the naked eye, or they may only be seen under the microscope. Those changes that can be seen with the naked eye are called gross morphologic changes, or those that are seen under the microscope are called microscopic changes. Both the gross and the microscopic morphologic changes may only be seen in dead diseases. For example, they may be specific to dead diseases. Therefore, such morphologic changes can be used by pathologists to identify, for example, to diagnose the disease. In addition, the morphologic changes will lead to functional alteration and to clinical sign and symptom of the diseases. So, dear ladies and gentlemen, we are coming to discuss functional derangement and clinical significance. The morphologic changes in the organ influence the normal function of the organ. By doing so, they determine the clinical features, signs, symptoms, cause, and prognosis of the diseases. We are coming to discuss diagnostic technique and use in pathology. The pathologists may be used the following techniques to diagnose or to treat the disease. Number A, histopathology, cytopathology, hematopathology, immunohistochemistry, microbiological examination, biochemical examination, cytogenesis, morphology, molecular techniques, autopsy. So we are coming to discuss histopathological techniques. Histopathological examination study in which we study tissue under the microscope. So what is tissue? Tissue is the collection of cells that work together. During the study, the pathologists look for abnormal structure in the tissue. Tissue for histopathological examination are obtained by biopsy. Biopsy is a tissue sample from a living person to identify the disease. Biopsy can either incisional or excisional. Once the tissue is removed from the patient, it has to be immediately fixed by putting it into adequate amount of 10% formaldehyde, 10% formalin before sending it to a pathologist. So we are coming to discuss the purpose of fixation is to prevent autolysis and bacterial decomposition and putrefaction, to coagulate the tissue to prevent loss of easily diffusion substances, to fortify the tissue against the deleterious effects of the various stages in the preparation of section and tissue forcing, to leave the tissue in a condition which facilitates differential staining and with dyes in other regions. Once the tissue arrives in the pathology department, the pathologist will examine The pathologist will examine it microscopically, in eye examination of tissue. Then the tissue is processed to make it ready for microscopic examination. The whole purpose of the tissue processing is to prepare a very thin tissue, for example 5 to 7 micrometer or 1 cell thick tissue, which can be clarified seen under the microscope. The tissue is processed by putting it into a different chemical. It is then impregnated, embedded in paraffin section, cut into thin slices. It is finally stained. So what is the stain? The stain is a color which we inject to a cell, through which we can identify different organelles in a cell. Stain can be hemotoxylin, eosin stain, or special stains such as fast immunohistochemistry. It is extract the hematoxylin eosin stain is usually abbreviated as H&E stain. The H&E stain is routinely used. It gives the nucleus a blue color and cytoplasm and extracellular matrix a pinkish color. Then the pathologist will look for abnormal structure in the tissue, and based on the abnormal morphology, she will use the diagnosis. Histopathology is usually the gold standard for pathologic diagnosis.